Hello, students.
Yes, ma'am.
Yes, ma'am.
Yes. Okay. Okay, now we'll start. We'll start with suctioning. What is suctioning? What do you understand by suctioning?
Ma'am, to remove secretion from mouth or any.
Okay, suctioning means we all know in a simple term, suction means when we suck something, no? When we take out something, okay, in the layman term. So we'll just have a short class today. Suctioning is the process of sucking the removal of gas or fluid from a cavity or rather container by means of a reduced pressure, okay? So suctioning is done when a patient is unable to clear respiratory tract secretion with coughing. Okay. So when we apply this when do we apply suctioning? When a patient is unable to clear respiratory tract secretion with coughing. And suctioning is the method of removing mucus from the lungs. Suctioning may be used to clear the airway of blood, saliva, vomitus, or other secretion so that the patient can breathe properly. Okay, because of all this reason we do suctioning. Then what is oropharyngeal and nasopharyngeal suctioning? It is the removal of the secretion from the oral or nasal cavity through the pharynx or through the pharynx. Okay, it is removal of the secretion from the oral cavity or nasal cavity or through the pharynx. What is the different types of suctioning we will talk about? Have you heard of oropharyngeal? Means from the mouth it goes down to the pharynx. Nasopharyngeal, from the nose it will go down. We will introduce the catheter, suctioning catheter. Then nasotracheal, from the nasal again, and suctioning through the artificial airways. Okay, these are the different ways we use. Then nasopharyngeal sites for suctioning is nasopharyngeal, oropharyngeal, endotracheal, and tracheostomy. You have heard of this, no? What is suctioning we have taken in the class. So I am going fast, okay? It is like a revision, I should say. So nasopharyngeal, oropharyngeal, endotracheal, and tracheostomy. And the purpose of suctioning is, what is the purpose of suctioning? Tell me, one of you. Yes, Kritanjali.
Removal of facilitate ventilation, take samples for diagnostic purpose, prevent infection, remove secretion from respiratory tract.
Take care. So this is a removing the secretion from the airway. Okay, because there is in the respiratory tract there is mucus collection or secretion collected there. Because of that, the person is not able to take properly. The thick mucus will block the airways. Because of that, we need to clear the airways. Then, so that it will facilitate breathing. Then obtain the secretion for the diagnostic purpose and preventing the thus we will prevent the infection. So have you seen this in the ward suction machine? Already demonstration
Yes,
has been done. I've shown you what our suction machine is and how it is being done. So this is a suction machine and these are the wall mounted, no, which we have seen already. Then suction catheter of different size with the different colors is available. Then size of catheter for usually for adult we use 18 French to 12 French, children 10 to 8, infant 8 to 5 French. Then have you ever done suctioning or have you ever assisted your seniors or the staffs out there in the hospital for suctioning?
Yes, ma'am.
Yes, very good. So how did you do? How do they do? Did you have done for the conscious patient or unconscious patient? It is done for the
Unconscious, ma'am.
yes, for conscious patients. Okay, so how you
And for unconscious patient,
how they did? Can you just relate how you did? Okay, at least tell me before you brought the machine, the suction machine, or maybe is it wall mounted one or they brought that machine that which we can move it. Which one they used that portable one, move, which they roll it and brought it near the patient side. Which machine they used?
Wall mounted.
Wall mounted. Okay. Then how they did before doing that? How they did? First thing before doing the suctioning, whether the suction machine is working or
ma'am,
not.
patient in the lateral position.
Yes. Then in the lateral position because the patient was unconscious.
Yes, ma'am.
Okay, for conscious patient, you will allow the patient to sit up, no? At least half semi-Fowler is like 30-degree angle. We have discussed the day before yesterday about the angle. So 30-degree, a little bit elevated. Then we will, and before doing the suctioning, what you will do, you will try to find out whether the suction is working or not also, no? So
Yes, ma'am.
if it's a catheter, if how you will know that the suction is working or not, how you will know? Pressure is there or not, how you will know? How they did? You can bring a bowl, no? Bowl of water. Your
Water, yes.
if they suck it, if the water is sucked, that means it is working, it is sucking, no? Because it has to suck, okay? And anyway, we need to flush it also. So at the same time, we are flushing the catheter as well as we are checking whether it can be sucked or not. Then only we can start the procedure. So positioning in semi-conscious patient, semi-Fowler's position, hyperextended neck. Neck should be extended. Just like in that CPR I showed you, no, the neck should be extended. Then head turned to one side. Okay. And for unconscious patient, as Nilima said, it will be lateral position, face of the patient facing towards us or towards you or towards the person who is going to do the procedure. Then you have to identify the patient procedure, determine the need for suctioning, why we need to do, explain the procedure either to the patient is unconscious, to the attendants, perform hand hygiene, adjust the bed to comfortable working condition, adjust suction to appropriate pressure. Then we have to use strict aseptic techniques, means sterile techniques. Okay, the suction should be very sterile. We should not contaminate. If contaminated, then we have to use another one. Then assemble the equipments and check the functioning of such. All the apparatus we have to check as we usually do before doing any procedure. Then explain the procedure to the patient or the relatives. Assess the baseline data and respiratory status of the patient. Example, breath, sound, ABG analysis of the patient, everything. Then provide semi-Fowler position to the patient. Then wear masks and wash your hands properly. Then you will place towel or whatever waterproof towel with Macintosh across the patient's chest. Wear glove. Then we will connect the suction catheter to the suction tube being connected with the suction device. Then when we connect, turn on the suction. Okay, turn on the suction, and if the person is on oxygen, we have to remove the oxygen when we are doing it, no? So we have to give 100% oxygen for at least some time, then remove the oxygen, then give it for about up to 15 seconds like that, because again otherwise during suctioning oxygen is deprived, no? So we have to make it fast. Okay, then when you have to turn off while inserting the catheter, and while removing out in a rotatory motion, you have to on the suction and take out the secretion. I hope you remember what I am saying. Yes,
ma'am.
yes. Then insert catheter to the mouth or nasal cavity. Move catheter in cavity until suction is cleared. Then after that, replace the mask or oxygen device. Rinse the catheter with sterile water or normal saline until the secretion is cleared from the suction. So what you will do is when you suction it, then after that you will have to, if the tube, no, the catheter of the, while doing suctioning, the catheter is already very much thick, sometimes very thick secretions comes out. What you will do, you will again dip in that sterile water. Then it will, when it suck the bowl, you dip the catheter in the bowl, and when you suck it, then again the catheter will be clear, no? Because the secretion will be going inside with the distilled water. Then again you clean it, again you give the oxygenation to the patient, remove the oxygen again, and again put the catheter in the same manner. Like that we have to continue till the secretion is clear. Okay, then before doing that, we need to measure the pressure, gauge pressure very carefully. Not too much of pressure will harm the mucus, nasal mucus membrane, then the GI, the the mucous membrane, then it might lead to bleeding, and again we will the patient will be another more with another more complication. Okay, so we have to be very careful, and we have to do it very smoothly and gently. Okay, then after care, evaluate the respiratory status, remove the towel, clothes, as we all know we have to do all these things, reposition the client, wash hands and clean the articles for suctioning, used for suctioning, then document the procedure findings and the condition of the patient and pre and post suctioning. So we have to do that documentation, how the patient was before the suctioning and after the suctioning. Okay, it will come in exam. You will be doing it. You will be able to do it, no?
Yes, ma'am.
Before doing the suctioning, how you will check the patency of the catheter?
We take a bowl of water and
Sterile water, okay, clean. Not this one. It has to be sterile water. Then dip it. Then if it sucks, then it is working. Plus, you will be flushing the catheter. Okay. Then after that, you will have to oxygenate 100% nicely when if the person is getting oxygen. Then remove the oxygen and then you insert it while inserting off it. Then only while trying to remove out, while remove, then you on the suction and in a rotatory motion you have to take out. Again you will insert and take out. And if the tube has got full of secretion, then what you will do again, you will dip in the bowl and do the suction in the water, clear it, then only you will do it. Understood? So some of the complications related to the suctioning may be hypoxia. What is hypoxia?
Fever, ma'am.
What?
Low of oxygen, ma'am.
Breathing deep.
low oxygen in blood.
Yeah. Okay, hypoxia. Hypoxemia is in the blood. Hypoxia is in the tissues. Okay. Forgot already. Last week only I discussed. Then there might be some cardiac arrhythmia, means irregularity in the pulse rate. Okay. And it might lead to damage to mucous membrane, and it might lead to bleeding. Again, it will cause more obstruction. There will be, if there is bleeding, there will be clotting. No, that should be avoided. Then leading to airway occlusion. Then bleeding disorder. So these are some of the complications. It doesn't mean that it will happen, but if we are not careful, and if we are not gentle, then these complications might occur. Understood? Okay. So that is a short class that I have taken today. Anything you want to ask regarding today's class? Okay, nothing then. Thank you.
Thank you, ma'am.
Thank you, ma'am. Thank you, ma'am.